Hello everyone, and welcome to this comprehensive pharmacology review session. Today, we'll be revising key concepts under the topic Introduction to Pharmacology through a series of multiple-choice questions. This video is designed to help pharmacy and medical students, as well as anyone preparing for pre-qualification exams like the PEBC, NAPLEX, or GPhC. Each question will be broken down to ensure that you fully understand the concepts behind it. Feel free to pause and review each question as needed, and remember that taking a moment to analyze a question before jumping to the answer can significantly improve your understanding. Challenge yourself, try answering each question on your own first, then continue to see the explanation. Now, let's jump right into our study session. Introduction. Pharmacology is a foundational subject in healthcare, focusing on how drugs interact with the body and how these interactions can be optimized for therapeutic benefits. This topic is essential for understanding the mechanisms, therapeutic applications, and considerations involved in drug administration and patient care. Let's start with the first question. Question 1. In pharmacokinetics, which of the following processes is considered the most important factor in determining the onset of drug action? Option A. Distribution. Option B. Absorption. Option C. Metabolism. Option D. Elimination. Option E. Bioavailability. The answer is option B. Absorption. The explanation is as follows. Absorption is key to determining how quickly a drug can reach the bloodstream and begin exerting its effects. This onset is crucial for understanding the drug's timing and efficiency in therapeutic settings. Let's briefly look at the incorrect options. Distribution, which is option A, influences how a drug is dispersed throughout the body but doesn't impact how quickly it enters the system initially. Option C, metabolism, and option D, elimination, are more relevant to drug clearance than onset. Bioavailability, which is option E, measures the fraction of the drug reaching systemic circulation but does not directly impact how quickly the drug action begins. A common phrasing trick in pharmacokinetics questions involves using the term onset, so remember to connect this word specifically with absorption. We now move on to the next question. Question 2 is as follows. Which of the following is the primary site for drug metabolism in the human body? Option A, kidney. Option B, heart. Option C, liver. Option D, lungs. Option E, small intestine. The answer is option C, which is liver. The explanation is as follows. The liver is responsible for the majority of drug metabolism due to its rich supply of enzymes. These enzymes catalyze chemical reactions that transform drugs into active or inactive metabolites, which is essential in determining the drug's duration and effectiveness. Let's look at the incorrect options in this question. The kidney, which is option A, is primarily involved in excreting metabolites rather than metabolizing drugs. The heart, option B, is vital for circulation but has no significant role in metabolism. Lungs, option D, and the small intestine, option E, contribute to drug metabolism but to a far lesser extent compared to the liver. A potential point of confusion here is understanding that metabolism primarily refers to chemical transformation, which takes place predominantly in the liver. Let's move on to the next question. Question 3. All of the following statements regarding bioavailability are correct except Option A. Bioavailability is influenced by the drug's formulation. Option B. Bioavailability measures the proportion of the drug reaching systemic circulation. Option C. Bioavailability is always the same across different routes of administration. Option D. First-pass metabolism can reduce bioavailability. Option E. Bioavailability is often lower for oral drugs compared to intravenous drugs. The answer is option C. The explanation is as follows. Bioavailability actually varies across different routes of administration. This is due to factors like absorption and first-pass metabolism that differ depending on the route. For example, an intravenous route has 100% bioavailability because the drug enters the bloodstream directly, while oral administration often results in lower bioavailability due to metabolism by the liver and gastrointestinal tract. The other options are accurate descriptions of bioavailability. Option A is correct because the formulation of a drug, such as whether it's in a tablet or liquid form, can impact how well it's absorbed. Option B is also true, as bioavailability measures the fraction of the drug that actually reaches systemic circulation. Option D is correct because first-pass metabolism, which primarily occurs in the liver, can reduce the bioavailability of oral drugs by metabolizing a portion before it reaches the bloodstream. Finally, option E is accurate. Oral drugs generally have lower bioavailability compared to intravenous drugs because they undergo first-pass metabolism and face absorption barriers. Question 4 is as follows. A pharmacist is preparing a dose of metoprolol for a patient with hypertension. Given that metoprolol undergoes extensive first-pass metabolism, which route of administration would completely avoid first-pass effect? Option A, oral route. Option B, intravenous. Option C, sublingual. Option D, topical. Option E, rectal. The answer is option B, the intravenous route. The explanation is as follows. Intravenous administration completely avoids the first-pass effect because it bypasses the gastrointestinal tract and liver, allowing the drug to enter systemic circulation directly. When given intravenously, metoprolol does not undergo liver metabolism before reaching the bloodstream, which makes it effective for drugs that undergo extensive first-pass metabolism. The other options are not suitable for completely avoiding the first-pass effect. Option A, oral administration, is the primary route where first-pass metabolism occurs, as the drug passes through the gastrointestinal system and liver before reaching circulation. Option C, sublingual administration, partially bypasses the liver but is not ideal for a medication like metoprolol, as it can be inconsistent in absorption. Option D, topical administration, can limit the first-pass effect but is generally not used for systemic effects in cases like hypertension. Option E, rectal administration, may reduce but not fully eliminate first-pass metabolism, as a portion of the rectal venous drainage leads to the liver. Question 5 is as follows. A patient is given a drug with a narrow therapeutic index, NTI. Which of the following statements about narrow therapeutic index drugs is true? Option A, NTI drugs require less monitoring. Option B, small changes in dose can lead to toxicity. Option C, NTI drugs are safe for all age groups without dose adjustments. Option D, they have a large safety margin. Option E is none of the above. The answer is option B. The explanation is as follows. Option B is correct because drugs with a narrow therapeutic index have a small range between effective and toxic doses. This means that even small variations in dosing can lead to toxicity, making them high-risk drugs requiring precise dosing and monitoring to ensure safe use. Let's look at the other incorrect options. Option A is not correct because NTI drugs require more intensive monitoring, not less, due to their narrow margin of safety. Option C is inaccurate. Dose adjustments are often necessary, especially for vulnerable populations like older adults or those with impaired liver or kidney function. Option D is false, as NTI drugs do not have a large safety margin, their safety margin is narrow, which is what makes them challenging to dose. Option E is incorrect because option B is the correct answer. Question 6 is as follows. Which of the following factors is least likely to affect a drug's volume of distribution? Option A, lipid solubility of the drug. Option B, plasma protein binding. Option C, the drug's route of administration. Option D, the tissue permeability of the drug. Option E, body water content. The answer is option C. The explanation is as follows. The drug's route of administration primarily affects the onset of drug action but does not significantly impact the volume of distribution. Volume of distribution relates more directly to how a drug is distributed in body tissues and fluids after entering the bloodstream, rather than how it initially enters the body. The other factors do influence the volume of distribution. Option A, lipid solubility, can increase a drug's distribution into fat tissues, affecting its distribution. Option B, plasma protein binding, limits the amount of free drug available for distribution, as bound drugs cannot cross cell membranes as freely. Option D, tissue permeability, influences whether the drug can move through specific barriers, such as the blood-brain barrier, which affects distribution. Option E, body water content, impacts distribution, as hydrophilic drugs often distribute more into body fluids than into fat tissue. Question 7 is as follows. All of the following pharmacodynamic principles are correct except Option A, agonists bind to receptors to elicit a response. Option B, antagonists prevent receptor activation by other agents. Option C, potency reflects the maximum effect of a drug. Option D, efficacy reflects the maximum response a drug can produce. Option E, partial agonists produce a weaker effect than full agonists. The answer is option C, potency reflects the maximum effect of a drug. The explanation is as follows. Option C is incorrect because potency refers to the concentration or dose needed to produce a specific effect, not the maximum effect a drug can achieve. Instead, the maximum effect that a drug can achieve at its highest concentration is referred to as efficacy. The remaining options accurately reflect pharmacodynamic principles. Option A is true as agonists indeed bind to receptors to elicit responses. Option B correctly describes antagonists, which block receptors and prevent other agents from activating them. Option D accurately defines efficacy, as it refers to the maximum response a drug can produce. Option E is correct because partial agonists activate receptors but produce a lesser effect than full agonists due to their lower intrinsic activity. Question 8 is as follows. Which of the following is the most important characteristic that influences a drug's ability to cross the blood-brain barrier? Option A, water solubility. Option B, lipid solubility. Option C, molecular size. Option D, plasma protein binding. Option E, route of administration. The answer is option B, lipid solubility. The explanation is as follows. Lipid solubility is the most important factor in determining a drug's ability to cross the blood-brain barrier, as the barrier is lipid-rich. Drugs with high lipid solubility can pass through this barrier more readily, making them effective for central nervous system (CNS) effects. The other factors play less direct roles. Option A, which is water solubility, limits the drug's ability to pass through the blood-brain barrier. Option C, molecular size, can impact permeability, but it is secondary to lipid solubility. Option D, plasma protein binding, also affects permeability but does not directly determine blood-brain barrier penetration. Option E, route of administration, affects how quickly a drug reaches circulation but not its direct passage through the blood-brain barrier. Let's move on to the next question. Question 9. A patient with liver impairment is prescribed a medication primarily metabolized by the liver. Which adjustment would most likely be recommended? Option A, increase the dose. Option B, decrease the dose. Option C, change to an intravenous route. Option D, increase frequency of dosing. Option E, none of the above. The correct answer is option B, decrease the dose of the medication. The explanation is as follows. For patients with liver impairment, decreasing the dose prevents accumulation due to reduced metabolism. Let's quickly look at the incorrect options. Increasing the dose, which is option A, could cause toxicity. Increasing the frequency, option D, again can cause toxicity. Changing to intravenous, option C, would not impact metabolism directly. Option E is incorrect as dose reduction is appropriate. Let's move on to our last question. Question 10. All of the following mechanisms of drug excretion are correct except A. Renal excretion is the primary route for water-soluble drugs. B. Drugs can be excreted via bile into the feces. C. Lipid-soluble drugs are typically excreted unchanged in urine. D. The lungs can excrete volatile drugs. E. Sweat is a minor route of drug excretion. The correct answer is option C. Lipid-soluble drugs are typically excreted unchanged in urine. Here is the explanation. Lipid-soluble drugs are generally metabolized before excretion and not excreted unchanged in urine. Let's quickly look at the incorrect options. Option A and B are correct as primary routes. Option D is accurate for volatile drugs, and option E is true, as sweat is a minor excretion route. Further tips for revision. As a form of recap, take note of the following 5 tips to help you tackle similar questions effectively. The first tip is that certain keywords in questions, such as except or not, can completely change what the question is asking. Pay close attention to these words to avoid common pitfalls. The second tip is that in pharmacokinetics, terms like onset, duration, and bioavailability each have specific meanings. Knowing these distinctions can help you focus on the relevant pharmacokinetic process, such as absorption or distribution. The third tip is that understanding primary sites of action or metabolism, like the liver for metabolism or kidneys for excretion, can simplify many questions. Linking organs to their primary pharmacological roles can quickly narrow down answer options. The fourth tip is that drugs with narrow therapeutic indices require extra attention to dosing changes due to their small margin for error. Always consider that even small adjustments can lead to toxic effects. The fifth tip is that lipid solubility is often a critical factor in understanding drug passage across barriers, such as the blood-brain barrier. High lipid solubility generally means easier passage across such barriers. Conclusion. That wraps up our revision on Introduction to Pharmacology. I hope you found this session helpful and that you feel more confident in tackling pharmacology questions. For additional reading, consider exploring Katzung and Trevor's Pharmacology, Rang and Dale's Pharmacology, and the latest British National Formulary. If you have any questions or comments, feel free to leave them below, and don't forget to subscribe for more content. Thank you for watching, and happy studying!